I'm Tate. Kristen is videoing me and Abigail is my evaluator. So I have the patient's order here for Jamie Wheeler, and I'm going to be giving him his medications, and I'm checking to make sure that the order's medications match with Jamie's MAR, his record. So I'll be giving erythromycin, 250 milligrams, varicella, 0.5 milliliters, and dexamethasone 4 milligrams, and that is all on the MAR, so it matches. I'm checking for allergies. He's allergic to codeine, which doesn't contraindicate any of the administrations. And I'm also checking lab values and anything else that would contraindicate administration before going into his room. So now I'll introduce myself and get started. Hello, I'm going to be your nurse today. My name's Tate. Could you verify your name and your date of birth, please? I'm going to check your wristband. Okay, Jamie Wheeler, 10/31/1947. Great, and could you tell me what you are allergic to? Okay, yep, I have here that you're allergic to codeine. I'm going to be giving you your medications today. I have 3 for you. Your codeine allergy doesn't contraindicate with any of them, so that's fine. I have 1 oral medication, and then the other 2 are injections, so I'll explain as I go along, but feel free to ask me any questions. And I would close the curtain for patient privacy and make sure my patient's comfortable. I'm going to get everything ready for you, and then I'll be back. Okay, so when I'm getting the medication, I'm checking with the MAR, making sure that I'm getting the right drug for the right patient, and getting the right dose and doing the right route. And okay, so I need erythromycin, 250 milligrams, and making sure to check the expiration date, and erythromycin, 250 milligrams. I need and some water. Okay. And then next I need varicella, so making sure to check that it matches the MAR, 0.5 milliliters, so I'll be giving 1 dose of that, and then I'm doing subcutaneously, so I'm going to need a 25 gauge needle, and I will get a 3 milliliter syringe for that, and then I need dexamethasone, and making sure that I'm getting the right medication and that it matches my MAR. So the order calls for 4 milligrams, and this is 4 milligrams per 1 milliliter, so I'll be giving 1 milliliter. And it's going to be intramuscular, so I need a 20 gauge needle because I'll be giving it ventrogluteal site, and then I'm going to get a 3 milliliter syringe. Okay, and I need gloves. Okay. So now that I'm in the patient's room, I'm going to double check that I got the right medication, that I have the right dose, and it's the right time, and the right patient, and the right route. So I have erythromycin, 250 milligrams, orally, and it's for Jamie Wheeler, and it's at 8 a.m. So I'll get that out. Okay. And then I'll explain my picture. Okay, so first we're going to give erythromycin. It's going to help prevent any infection that you might get, and some side effects may be nausea, vomiting, or a rash, so we'll be looking for those. And then before administering erythromycin, I would check his heart rate because a low heart rate is a contraindication for the medication, and I would also assess for any signs of infection. So white blood cell count, appearance of he had a wound, and then I would monitor bowel function to be looking for signs of C. diff, because that is a reason to hold the medication. Okay, so I'll get that for you. And then before administering, I would do one more check. So I'm doing my 3 checks, making sure that I have erythromycin, 250 milligrams orally. It's for Jamie Wheeler, and it's at 8 a.m. So my 5 rates. Here you go, Mr. Wheeler. Here's your pill, and here's some water. And I would make sure that my patient swallowed the medication, and I would just continue to assess for any of the side effects or adverse reactions. And then I would document that I gave it at 8 a.m. and I gave erythromycin 250 milligrams, and I would document that he swallowed it and any other assessment findings. Okay, and then I'll get the other injection ready. So I'm gonna check it again. So I have varicella vaccine, 0.5 milliliters, so I'm going to be giving 1 dose, and I'm doing it subcutaneously. It's for Jamie Wheeler, and I'm doing it at the right time. And I'm going to double check subcutaneously, so this is a 5-gauge needle. And then I'm going to draw up 0.5 milliliters of air before. Okay. And then inject the air. Just make sure that I got any air bubbles out and making sure that I have 0.5 milliliters. Okay. And then I need to change the needle. And then I'm going to dispose of this. Okay. So I'll explain it to him. All right, Mr. Wheeler, I'm going to give you your varicella vaccine injection. It's going to help prevent the varicella zoster virus, so you won't get that. And before administrating, I would check white blood cell count to check immune function, assess for reaction symptoms, and assess like his previous immunization history. So I'm going to be giving this to you in your abdomen, and some side effects may be anorexia, chills, diarrhea, fatigue, fever, headache, injection site reaction, so we'll be looking for all of those. Okay. And then before administering, I would do one last check, making sure that I have the right dose, which is 0.5 milliliters, and the right medication, which is varicella checking that with the MAR, and I'm doing it subcutaneously, so I have the right route and the right patient, and the right time too. Okay. Okay, so I'm gonna uncover you and lift up your gown so that I can get to your abdomen, and I would make sure that to check like what previous injection site that he had, so I'm changing it. I'm going to be doing the right lower abdomen. Okay, I'm going to clean it and then leave it. Okay. Okay, so I'm going to pinch a little, and then you're going to feel a little stab, but it will be quick. I'm going to pinch about an inch and do it 45 to 90. And hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull it out. Okay, it's all done. And then I would dispose of this and do the safety and dispose of it. Okay, I'll cover you back up, and then I'll get your last injection ready, so you just have one more. And after administering, I would document that I gave varicella vaccine 0.5 milliliters in the right lower quadrant, and I would document the time that I gave it subcutaneously. Okay, next I'm going to check again dexamethasone, and the order calls for 4 milligrams, and this is 4 milligrams per 1 milliliter, so I'll be giving 1 milliliter. Checking to make sure that I have the right patient, and I'm giving it at the right time, and it's intramuscularly, so I have a 20 gauge needle. Okay, so I would draw up 1 milliliter of air. And clean it before I do it. Okay. And then I would inject the air. Okay, and then inject 1 milliliter, making sure get any air out. Okay, and then I would make sure there's no air bubbles and that there's 1 milliliter, and then I'll explain it. I will need to change the needle because I need a 20 gauge. Okay, and then I'll dispose of this. Okay. last injection, Mr. Wheeler, I'm going to be giving you dexamethasone, and this is going to be for your arthritis, so it's going to help suppress that inflammation and reduce it. And before administering, I would assess for signs of infection because that is a contraindication. So I would check white blood cell count, and I would assess like the involved system. So I would assess his arthritis and signs for adrenal insufficiency, and observe for edema. And Mr. Wheeler, some side effects are depression, euphoria, anorexia, nausea, decreased wound healing. So we'll be looking for those. And then before administering, I would check one more time with the MAR that I have the right patient, Mr. Wheeler, and that I have the right medication, which is dexamethasone, and I have 1 milliliter, and I'm doing it intramuscularly, so I'm going to be doing it in the ventrogluteal site, and I'm giving it at the right time too. Okay, and I'm going to have someone help me with the patient. Okay, Mr. Wheeler, so we're going to have you roll to one side so I can give this injection to you. Okay, so I need you to lean towards Abigail. Okay, and I'm going to uncover your side. Okay, so to find the ventrogluteal site, I would put my palm on the greater trochanter and put my pointer finger towards the anterior superior iliac spine, and then my middle finger to the iliac crest. So it's going to be about right here. And I'm going to open this and find it again. Palm, anterior superior iliac spine, and the iliac crest, and then clean in between my fingers, and then leave it so I know where my site is, and then I'm going to pull this back, and okay, and then it's intramuscular, so I'm going to do 90 degrees this side. And I'm going to do a Z-track, so I'm going to pull about an inch to the side. Skin doesn't find it cute. Okay. Inject. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, Mr. Wheeler, you're all done. And then I would safety. And then I would document that I gave dexamethasone 1 milliliter in the ventrogluteal site, and it was IM, and at 8 a.m. I would document the time, and then I would sign this, and I'm student nurse and my initials. And then I would just keep assessing my patient for any side effects or adverse reactions of the medication, and I would make sure that my patient is comfortable, and